Okay, we're back from our brief break, and we are ready for a proposed settlement agreement for John Hendrickson, DVM, cause number 2025 BB 0006. Has everyone had an opportunity to review that settlement agreement, and are there any questions, concerns, commentary?
My only concern was there was no CE involving immune-mediated thrombocytopenia. It was just about antibiotics.
Okay.
And to
Noted.
me, the concern was the platelet count was 22,000, and he attributed that to a machine error. But he didn't do any blood smears to look for platelets or try and confirm that.
Just assumed it was
So the
clumpy.
dog wound up at Purdue with
and-
blood transfusions. Now,
Oh, I
granted,
understand.
he's, I think, paid the bill for all that, but there was no
That was not
CE
good
or
practice.
ITP.
And on top of that, prescribed or recommended aspirin to an
Yeah.
animal who has minimal platelets.
Yeah. But to me, there were two things. The dose of Bactrim was way too high. The TMZ, it was way too, even for an old guy like me, it was too high. A 50-pound dog, a 960 twice a day, that's a lot. I would have given that to a Great Dane. And, the antibiotic CE course, I'm sure probably addressed immune-mediated issues with sulfas and maybe KCS. I get, that's fine. And I'm not saying we shouldn't accept it, but the part that I would have liked to have seen is 3 hours in ITP. Because I don't think he really addressed that. That was a big part of the case. However, the dog went to Purdue before he had a chance to recheck it, so that I would let it slide from that standpoint. He was going to recheck the dog on the 18th, but the guy went to Purdue on the 16th.
Well, but his response to how the dog was doing and feeling was inappropriate in what he recommended that he do.
So he was going to follow up maybe on that platelet count on the appointment on the 18th and didn't get a chance to. But it should have been addressed
Straight away.
the first time he checked the dog.
Right.
Actually, the 16th, he wasn't going to see, that's when they told him, they said it was still in pain. That's when he told him to give the aspirin.
Yeah.
That was my point.
And then,
And then it went on.
set him up to come back on the 18th.
It doesn't say it in here, but
Yeah.
Where does he
But then the
practice?
dog wound up going to Purdue before it got rechecked.
Where did he practice?
But the 18th, if the
I-
owner hadn't have been diligent,
I read all.
Wayside
would not be
Veterinary
living
Clinic in
that
Frankfurt.
many days after.
Way,
Yeah.
oh, that's the one.
Frankfurt.
So, what is
Between
what is see as a result of
Lafayette
that?
and-
Where you,
the CE was on
Yeah, I think you're
antibiotics.
right.
It wasn't on the.
Okay.
immunity.
Because it's 22.
oh, there it is.
23,000.
Which is what's happening.
Hopefully there's some good
That would
senior
take-
student up there at Purdue to learn something.
Yeah.
I even know that.
Right, right.
Well,
Yeah, that
and
one
it-
was way more than
He
not doing.
attributed that to a
They said, oh, maybe it was a machine error. Well,
gathering the troops here, we either accept the settlement agreement
But there's CE
or
that
we reject it. And I know there's a couple things you're not real happy with, but,
Yeah.
I mean, like.
Doing these settlements isn't easy, I sympathize.
Yeah.
but that takes me though quickly to your comment that we can't have imposed CE and just a letter of reprimand. But is this one not a letter of reprimand and CE?
Because he's doing the CE as a
Voluntary.
mitigator.
To make the settlement
To make, to not have probation, essentially.
Why
So
couldn't
you're
we
not
have
ordering-
done that on the last
Because you're not
case?
ordering CE, he's already done it.
You did.
You're
this, didn't you,
accepting it
Laura?
as a mitigating factor
Okay,
and just issuing the letter of reprimand.
Or is that, what are you guys talking about?
I would like to be able to do a letter of reprimand.
It's not our first rodeo.
For patients,
For,
because under the statute,
we need to change the statute, that's my point.
I got it right here.
good luck.
No, okay. All right, anyway, are we ready to call the question and vote?
Did I do the settlement?
So, but I wasn't there. I don't,
Roy, did I do this?
We did not have a settlement conference on this one, Dr. Clemente.
Okay, so I can plead the fifth on this. Usually you and I do
We did not.
a Teams meeting and
We did.
Sounds like I didn't have it. Who put this together? Me?
And he is not here today because we have this. Like,
Yes.
So we have a sign, we just have to agree
You
to
either
it.
accept it or
Appropriate.
reject it.
The hope is that we would accept it and this is done, but yeah, we have rejected them before, after this.
So
Then they
I will
come
put
back.
it back on I will put it on the schedule for a hearing in October.
Mhm.
And if they have a different settlement that would meet the board's recommendations today, then that could be put on the
I
agenda
just
too.
don't like that there's 22,000 platelets and we sent them on aspirin and ignored them. And that's how quick everything turns, because that is how quick everything turns when you have 22,000 platelets.
May I ask a question? Rory,
You're asking me.
how old is this guy? I mean, is he old or is he a young student? It enters into,
he's at least your age and my age that he prescribed that high a dose of Bactrim.
well, that's unfortunate.
Rory's shaking her head.
Rory can't actually, this isn't a hearing.
You can't say.
You can accept the agreement or reject the agreement.
That's no fun.
But just because we reject it doesn't mean they can't come back with another.
Correct.
It can be a hearing, settlement conference, and Dr. Sunbury probably would do that. Put in there everything he wants done. Have you done it
Well,
yet?
I guess a question, are we looking to want this person to be on probation, or are we just wanting additional CE done as a way to mitigate? So,
Isn't that the same choice?
No, not technically.
No.
So you said that you'd have to be on probation to mandate a CE?
right, but
This isn't mandated CE.
Right.
he did that ahead
So
of time.
if you
Right,
were
right.
to do whatever CE Dr. Clemente had mentioned prior to
Right.
submitting an agreement,
But if our main sticking point is that there's so many errors here that were really bad, we want you to do CE, then automatically our choice is probation.
Well,
No,
since we're
We can
sending,
just reject the
we can re-
agreement and we can have a new one presented to us in 3 months when maybe all of this CE that we're talking about has been done.
So we say, hey,
And
do the
Rory
CE.
can take that
Someone is
back
sitting
to
there that
her
might
clients
say that.
and say, here's what you need to get done beforehand. We'll create a new settlement agreement and bring it
I would feel better
before.
about that.
You what?
I would feel better about that.
Well, I think Paul would too. Not to put words in his mouth.
Are you suggesting, though, that you're concerned enough about the 22,000 platelet count that it should be more than a letter of reprimand? If you feel that way, you need to let us know.
Right, because it's one thing to have Rory go back and say, you need to complete this and this additional CE, and then we'll resubmit basically the same settlement. Or we have to reject it completely and say, we need to have a hearing because we want to put this guy on probation. That's the question.
but remember, when you put somebody on probation, they have to take affirmative steps to establish and prove to the board that whatever the issue was that caused him to be on probation has been remedied. And to be remedied, it's usually through
Doing
continuing
CE.
education. There are some other things that they can do, in this case, that probably wasn't appropriate. I mean, like if you had somebody who was on probation because of like a substance use disorder, then they would go through like a wellness program or something like that. But here,
I feel like that's an easier decision to make than this.
I think
When
he
there's
needs-
substance
he
abuse
needs a
involved.
course.
But essentially what you're saying is the point would just be to get to the CE, that's the only,
Right.
there's nothing else we can do as a board to improve their practice besides recommend E. CE.
I
Pretty
mean,
much.
you could, I guess,
Or-
you could make them go
Have a young, brilliant
Back to
veterinarian in your hip
residence, like,
pocket
go back
telling you
to-
what to do every day.
veterinary school or something like that. I mean, I've seen the medical board do stuff like that, but those were incredibly egregious cases with multiple patients.
That's
I
scary.
remember being a liaison on this and pointing out that there was a problem, obviously, but it didn't get to the settlement stage with me. I advised the Attorney General to pursue the case because of
Right.
what happened. The antibiotic dose and the community, I remember doing that. But it didn't come, usually those kind of come back where Brittany and myself and Lori.
Can I ask if there's any situation in which you were all willing to accept this agreement right here as it's written, or?
I don't
is-
think so.
Okay. I think that's the main decision we have to make.
So the real question is, do we feel like we have to, quote, punish this person with probation? Or can we send information back
I
to?
don't
No,
think
that's not a question that
Yeah.
you can answer today. The
Why
question-
not?
Because there's no hearing, you're either
Well,
accepting
we
it
all-
or rejecting it.
Oh, I understand, but the reason we would be rejecting it are twofold. Either we don't think enough CE has been performed in the correct areas,
Right.
or we don't think that the result is aggressive enough and we're letting this person off the hook because they're not practicing good enough veterinary medicine.
That's fine, but you can't make a decision today other than accept or reject. The decision is that he'll come before us for a final hearing.
I understand, but the only reason you really need him to come before us for a final hearing is if we're driving toward probation.
No. If we talk about this, his lawyer's sitting right over there, she'll take it all back. Do they?
I mean, the parties can submit another agreement, but.
Well, that's
right-
what I'm pushing
Well,
toward.
that'll be up to
Right,
the
but you can't
veterinary.
make them do that.
That'll be up to the doctor, Hendrickson, and Lori to decide, let's propose another updated settlement. That's up to them. We should just vote to reject this one and then go from there.
I have an agreement here where Lawrence Street, and actually Lori was on this, where they had a proposed settlement and it was accepted. And the mitigating factor was a CE, but then he only got a letter of reprimand. That's from back when Curtis Hill was the Attorney General.
Right, and that's fine. The problem is that they don't think that the CE that he did was sufficient to remedy the problem in this agreement.
So I make a motion, we
Oh,
reject
yeah.
the settlement agreement as written today.
I have one more question before you do that.
I second it.
Discussion.
Okay.
Discuss. Thank you. Here.
Just real quick, just to clarify, so this means, I get that this is reject and then let him decide what he's gonna do. But if we also want to hear from him, to hear what he said different or why he did this or whatever, that's off the board now because we don't have a hearing? Or he could do that,
Just for today.
but he could do that in October?
Yeah.
Okay.
Now, it is good for the attorneys of record to know that maybe an open agreement where the respondent is here and the board can ask questions, because that seems like the board really wants to ask questions as to what things happened. So a hearing or an open agreement where questions can be asked of the respondent is probably more appropriate in this case.
Because I feel like there's so much with the client. What if the client said I couldn't come or I didn't want to come? I don't know. I just think there's more we should know about.
So,
Or a settlement conference could be appropriate too.
well, that's the thing, is that there are times when I do a settlement conference with Rory, and I think we're good, but then I don't realize maybe one of the other members of the board, like Dr. Peelman, has some concerns that, okay, there were things that were not addressed in this agreement. So, you know,
But oftentimes, those discussions lead to additional mitigating factors being put in the agreement before it comes before the board to answer those questions, so.
yeah. I don't remember ever doing a second settlement agreement, a revised one, but that, you know.
We've rejected them and had them come back the next time with stuff changed and said, oh,
Yeah.
that's what we were hoping.
But
to
I
see.
don't remember getting back on TV with the lawyers and discussing the second settlement agreement.
But that didn't happen this time.
Point of
This was the
order.
first time.
We got a motion and a second on the board.
Yeah, it's tabled at the moment. We're in discussion of it, so that's okay. As long as you want.
But I think, not to put Lori on the spot, but I think she may approach the doctor and say, the board really wants to talk to you.
And then they get to decide whether
What
they
they-
want to
whether they
present
wanna-
a new settlement agreement or
or
whether
come
they
see
want
us.
to request a hearing,
And while he's waiting, he could do some.
additional CE, since she overheard us talking about it. So, okay, we do have a motion and a second on the floor. Are we prepared to vote on that?
So the motion is to reject the current settlement.
That's correct, period.
John seconded.
All in favor, signify by saying aye. Opposed, same sign. Okay.
Wait, who is the first? Thank you.
Okay. That, as they say, is that. We're ready for continuing education. Who wants to talk about open
No.
castration of cows?
The Office of Attorney General needs to do a report first.
Can I ask you a quick question?
Oh, I'm sorry.
Like 30-second on a process. When an agreement has put here, but there wasn't a pre-settlement conference, that was just reached between attorney and Attorney General's office? Okay,
Yeah.
so the board,
The respondent,
respondent and Attorney General's office though, no one from the board was involved.
More often than not, those do involve.
we have.
That's what, I guess my,
report of
part two
here.
to my question was, how did they
But,
decide when they
JC
involve
was
someone from
indicating
the
that we
board
don't
or
have
not?
that.
Like,
She's willing.
in this case where it's
Well, she
very
doesn't have to,
clear,
I
it's
just-
technical
I missed it.
and
Is all.
Yeah, that's
I
fine.
jumped
Actual
down to the
care.
next thing.
Good point. That's
Sorry.
why, when I read this, I
Like,
thought,
I was
well,
curious on.
when I read this, I thought, well, Steve
Their
must have
attorney
done
general's
this.
about to present, so maybe I can just ask their office, but how they decide to involve the board in pretrial versus.
Well, when I was deputy attorney general on this board, I don't know anything about veterinary medicine. And so I utilized liaison with almost every case, including with settlement agreements, because I don't know what the appropriate CE would be. I mean, there are times that I couldn't, well, I think that there are times when the veterinarian can't even find the right CE on an issue because
Big issue.
it's just not out there, but getting that input from Dr. Clemente or Dr. Sunday or anybody is really helpful in getting,
That was a choice you just could make as the DAG.
yes, but I did it on every case.
Can I say something that's unrelated to this case? So I think, would that be okay? Brittany?
Yes,
We did, since I've done so many settlement conferences, I used to do almost all settlement conferences. Then we started doing something where the attorneys and the vet would come up with a suggestion, and we would have a telephone call with Dr. Clemente and talk about the courses. Then we started submitting the courses to Brittany, and Brittany would email Dr. Clemente and come back. And then recently, like I'm gonna say in the last, since Brittany's been here, maybe even before Brittany came here, so relatively recently, we had some conferences that, or some cases where the attorneys just had a discussion, do we think this is sufficient or do we need a settlement conference? And we decided that we would just roll the dice and do a proposed settlement agreement without a settlement conference. And some of those were approved. So I don't think that you can, generally speaking, say you always need a settlement conference or you never need a settlement conference. I mean, this case would show that that was the wrong decision, but we have had others that didn't. So if you guys think like what your comment, you want to talk, I don't mind. I'll just start going back to how we used to do it years ago, which is settlement conference. That's my takeaway, is that that's probably what I would
no,
recommend.
that's fair. I mean, there were times where you know that you don't need a settlement conference because you already know the issue's been before the board,
Based on
or
previous experience.
or it's an issue that doesn't require CE or something like that. And then sometimes you have clients that just need to hear something from Dr. Clemente because they're not wanting to settle. So there, I mean, there are different times. I would just say generally I would do them just because I didn't know.
Okay, yeah, I was just,
Sorry, just thought that might help.
Thank you,
I was
Rosa.
realizing once we started down this that
But
they
To
they just kind
answer
of
your
appear.
question, probably more in the past, more cases went to the liaison and had a settlement conference with myself or
Mhm.
whoever was doing it at the time. And Rory's experienced enough. I get it on this one. She was close. In my opinion, we're only one CE course short of
Yeah.
approving this. But Dr. Peelman has a little bit more concerns about it than I did. That's why I'm not so sure we shouldn't
Okay, that makes sense to me.
we shouldn't necessarily send Rory back and say, hey, just add a course on immune-mediated thrombocytopenia and it'll go through. It might not. Until I heard from Dr. Peelman, she's got a little bit more concern.
Or unanswered questions.
Yes. So I don't want to,
Not to say that there are lots of cases in the future that you couldn't do it this way, but I don't think it's an error of anyone's judgment that we've decided, nah, we need to see them. I think it's a really good, like, almost filtering system. I don't think you did anything wrong. Just looking at it, I think, we probably should get more information.
And since I'm not a veterinarian, even though I like to play one, but you know, like I'm not, so sometimes things objectively look. We're compadres that way. Sometimes things objectively look to me like, I can see this is a problem, and sometimes I really don't know until I sit here and listen to all your comments. Like you guys said something, I'm not gonna say what it is, but you guys said something that I was surprised that was the response. Others around the table had no issue with it because you're all veterinarians and most of you are, know that. So there is some, I'm taking what you're saying to heart, and because I may not know the case, then I think the default might be just doing the settlement conference so that you all, the experts, can decide whether the discussion needs to happen or not. Anyway, that's my takeaway from it. Thank you though.
Thank you.
I mean, settlement conference that we do, you guys have rejected a couple of mine.
Yeah.
Yeah, you know.
I remember.
Yeah. John one time said, that's not enough. And I just thought, well, okay.
I only had one I filled in for you and they rejected it. So.
It's harsh being judged by your peers.
All right.
It's a good batting average.
Attorney General's report?
Yep, as far as your report, I apologize, I skipped over you. I didn't mean to, so feel free to go right ahead.
Okay, thank you. I could do it. Okay, so just a few quick things for you guys to know. The average age of investigative file right now is 6.81 months, trying to get it below the 6-month mark, but our target's usually 9, so looking good there. We have 81 investigation files open right now. We were able to close out 28 files in the first quarter, 22 in the second quarter, and then so far early in quarter 3, we've closed out 7. I don't know how much that number's doing for us now. The average age of litigation file here is 6.6 months, about the same as the investigation file. And then we have 11 litigation files open right now. Recently, last quarter, our litigation file resolutions, we were able to settle 4 cases, and then we have 1 cease and desist granted. And then if you guys have any questions for us, happy to answer them.
I think we're good, thank you. Appreciate it.
Amazed at the number of open cases. Does that mean people?
Has Dr. Clinton been filing complaints against?
Just even on the equine dentistry thing.
Have you been filing complaints against unlicensed equine
You
dentistry.
guys told me to stop doing that. I haven't done
We're
it
just trying to figure out how we got to 81.
I haven't done it in a long time, no.
No, I just,
My wife had a total knee replacement, we haven't gone anywhere.
no, I just think 81 is, there's a lot of people complaining.
A lot of
There's a lot of
angry-
people doing things that are questionable, I guess.
A lot of people, I think people, quite honestly, are a lot more informed that they can file a consumer complaint than they were 10 years ago.
Are there willing, well, yeah.
I had 3 phone calls a couple of weeks ago about the same veterinarian, and I referred all those to make a complaint with the AG's office, so they might be multiple.
Okay.
You told me you wouldn't bring that up about it.
I didn't say your name.
Okay.
Well, that's good, because I think if you get the complaints, if you have to turn them in to the AG. And I'm not sure in years past that was done. I'm sorry.
I'm doing it.
That's good. And I'm talking many years ago.
I get about 1 phone call a month. So, Dr. C, you're on the board, and I say, stop. You want to ask me a general question, like you drove drunk and ran into a light pole, are you in trouble? Yes. But stop. Don't tell me anymore. Because if people find out you're on the board, they'll call you. Well, my associate, I tell him, nope, stop. Because if you tell me anything, then I have to recuse myself. Don't tell me anymore.
And we don't want you to recuse yourself. Institutional memory is good,
Okay to move on?
I guess.
Okay. Excellent. Now we're at continuing education. 2 in front of us, best practices for disease prevention in calves. I guess we should defer to Dr. Moonberry because he is our mixed animal expert. I do no cows. Anyway, it sounds like the presenter was well qualified from U of I. It was for 2 hours of CE, and it was last month.
So we're just,
There is nothing in the rules that says that they cannot apply for CE even after the course has been
okay.
completed.
And those in attendance, I'm sure, would appreciate being able to not just get the education, but get some CE to go with it. So
Well,
I'm not a ruminant expert by any stretch, but it looked like decent CE.
Where does it say how many hours they're applying for? I always keep looking for that.
It's
It
a
was
really
up more-
small box, like kind of up at the top.
Yeah, up near the
but
top.
The program to be offered.
2 hours. So this one was for 2 hours.
Yeah, the next one was for 1 hour.
Because this was a lot for just 1 hour, you know.
The second one.
No, this cat one.
Oh, but it's for 2 hours.
Yeah, but I couldn't find it. I kept looking around.
It's really small.
Yeah.
Yeah,
Yep.
it is awkward.
Yeah.
Anyway, everybody okay with that? Or do we need to vote on that?
probably.
Okay.
Yay.
All those in favor of accepting the CE for this meeting signify by saying aye. Opposed, same sign. All right. The second was nasogastric and nasoesophageal placement for medicating and/or nutrition for short-term effort on patients needing that. Of course, a pharyngeal type of tube will be required for longer treatment, but again, looked like for just an hour of CE, a significant amount of information.
It's good.
Okay, all those in favor of accepting this CE for an hour signify by saying aye.
Aye.
Opposed, same sign. Okay,
Can I ask a question quickly
of me?
of you and or the board and or Brittany?
It just threw me off again.
At one point, it was thrown out at one of these meetings that, does the CE necessarily need to be brought before the board every time? Is it something that, one member of the board could look at or could be directed to? Is that still a thought process, or did we decide that we wanted to see all the CEs, or just curious?
I mean, I would be, I think that would save time here.
That's where I'm looking at.
And I would be okay with it as long as a veterinarian could look at it, because some of them I could probably get away with, but not all of them.
But in the scheme of this meeting, I mean, these took
Time-wise.
5 minutes.
Okay.
I mean, so
Curious,
I
that's why
don't
I
really
want-
think it's much of a drain on our time here, but I appreciate your point, but if we had 8 or 10 of them we had to roll through, that would be
The
different.
only thing that would do to help the organizations is that because you only meet quarterly, that they could apply for this in May and do their June CE and already have it approved before it actually occurs. So that's the only point.
For
So
$125
theoretically,
a day, I mean, we could,
You could do this with just one doctor's review without the whole board looking at it.
I mean,
Is that a rule?
I don't, there's no like procedure established in the rule or statute about how the board approves the continuing education, so.
We could do it without having to go through a whole bunch of stuff.
And unless Clarence has information that I don't about.
probably do
I
it.
think
If you check, if, I
I guess-
wouldn't assign one of us to do all of it, I'd say you got 2 old people and 2 mixed animal, 3. You know,
Let
you can
Natalie
pick
do
and
it.
choose who would be the best to approve it.
I think I brought this up once before. I had a pharmaceutical rep one time that's Southern Indiana and said, you know, it seems like it takes so long to get anything approved in Indiana. In Kentucky, we just upload it to their website and usually within, a week, we have a reply, yep, it's been accepted or it's not. And again, totally different state, totally different situation. But that just got me thinking, is there a different way that we should look at it?
I mean, even if Dr. Sunbury agreed to do all of them, if there was something that came before him that he wasn't familiar with, but like Dr. Clemente was, he could just say, hey, Dr. Clemente, would you look at this? Or he could say, I'm uncomfortable with 8 hours being issued, let's go before the full board or something like that.
Yeah, it's been better since the move to the Center for Animal Policy than it was before. I mean, when these had to be approved through the IPLA, they were taking way too much time, and they weren't getting any response. I know my drug reps, Sarah Pate for Pfizer and Garrett for BI, they're like, what is going on? I submitted this thing 3 months ago. We still don't have an answer.
Yeah, so as it is right now, the board is approving them during the meeting, so that's only quarterly. But some of them will email, and when I tell them it's okay, like if you're okay with the board meeting in 2 months or a month after the CE and waiting to give your, students, yeah, that CE, then that's up to you. And I think I only had like one person say, no, we're gonna just scratch it.
Well, you don't even get programs from AVMA or any IVMA or all those places that are automatically.
Yeah, those are pretty, yeah.
They're not still sending you stuff.
No.
I didn't think so.
Well, can they send it to you and then you just know that I have been given so-and-so the last couple, so I'm gonna pick someone else to give it to? And you just kind of do it without,
Can we do
Well,
that? We don't
structure.
have to have a rule change or anything to do that, do we?
that's it? No,
Then let's do it.
that's up to you guys.
No.
You are the board.
I would say that would be fine. And if we don't need a big firm structure, then you just use your discretion and just try to toss them at this person and then somebody else and then somebody else.
Yeah.
Yeah, if there's not a rule that says the whole board has to vote on these, then I don't see why we couldn't change it. There's not a rule prohibiting it.
Do we need to vote on that?
I don't think you need to have a vote on it, but if you don't want to do that, then
Is everybody
Step
okay
down.
with
Yeah.
taking one if it comes your way?
I would imagine if somebody feels like they really can't make a decision, you can throw it back and say, I want the whole board to look at this at the next meeting.
yeah.
Don't send them to me.
I mean, from a non-medical
Oh, yeah,
perspective, you
yes.
probably would not be
Only
the
DVM.
best choice to assess whether the CE's acceptable or not.
And I can assist Brittany in getting it to one of you all.
It might make more sense
Yeah.
going to.
Yeah, so I mean, we can work together on that. That's not a problem.
Okay.
She knows how to find me.
Yeah, I
Even-
think as
even
long as
doc-
there's just
yeah.
a mechanism that, like, if somebody was like,
And
oh,
Dr.
I had a
Shipman
couple
as ex
questions.
officio director, or supervisor, he could even tell you.
So technically, I think yes, because you guys have given me the ability to approve VTNE and Navigate retakes. So if I had questions, some of these are things that you guys have approved before, but it's been like 2 years or something like that. So they're just refiling something. If I had questions on it, I could ask him, and if he doesn't know, then we could send it to the full board or to one of the board members, or,
Because
whatever.
you're officially the head of the board, even if you
Yeah,
don't
the
know.
technical advisor, yeah,
Yeah.
and the chief
So
administrative
there's-
officer.
No reason.
It sounds very efficient.
very important.
What code is this?
Well, that makes it easier,
Yeah. Sure. That's,
I support
Okay.
that.
since you're right down the hall.
and yeah, if we have any questions or not sure, then happy to send that out or add it to an agenda item to be heard by the board.
Okay, so just to be clear, going forward, CE approval is with me and Dr. Shipman, and then if we need assistance from a board member, we will do that, or the full board, depending on the circumstances.
Yes.
Yes, I think that's a great idea.
Good idea.
Good move,
Thank
Steve.
thank Dr.
Good
Manberry.
He's been around a while.
Kyle, just so you know, we're not big on flower therapy.
Noted.
Now, instead of getting that out.
I got asked,
we'll
I
get
got
out
asked
of
to approve one.
For
There
what?
was some weird one
Flower
last time
therapy.
too, wasn't it? It
Like
was
petals or like?
Yeah, flowers, like,
Oh.
Lisa can tell you,
Oh,
that
you
they
weren't
tried to
joking.
do it at the IVMA. Or AVMA, they tried to do it one
I
time.
don't think you'll have any questions.
Yeah.
It'll be clear
It was
yes or no.
considered
It'll
alternative
probably be
therapy.
nice for the people
I
to not
should
have to
say
wait 3 months if they
aromatherapy.
get in the weird window.
I
on
think
their
so
board
too.
meeting.
Dr. Shipman, do you want to do your report? Do you have something important? Not trying to get rid of you, but
No,
if you need to
I'm-
bolt, you could
I'm
do
good.
yours and go, or
He
you can
needs to
hang
stay.
with us. He
Yeah.
needs to stay for the
I'll
rules,
stay.
or?
He's very
She wants him for
involved
discussion.
in,
We
The
meet
rulemaking.
often on the rules.
Okay,
So.
all right, I was just trying to
No, you're good. You're absolutely fine.
throw you a bone.
No, you're good.
No bonus.
Brittany went
No bones thrown. Okay. We're to discussion and proposed changes to rules. I'm assuming you're gonna
I
guide
guess
us
this is
through
me.
this.
Okay.
Yes.
so so we're gonna do Rule 6 and 8 first and kind of together, because those are applications. And then we'll do 7 and 9 together, because the way the rules are written, they're not written together as one rule. It's like DVMs, and then RBTs. So Rule 6 is DVM applications, Rule 8 is RBT applications. And the biggest changes, the biggest change to both of those is the elimination of the jurisprudence exam. The
Elimination of what?
jurisprudence exam.
The test you just
The
did.
test we slid just right through. Did great on it.
I'm sorry, I got bad hearing, I admit it.
It's okay.
My wife tells me every day.
Otherwise, we have
That's selective hearing.
modernized. Do these up?
I graded their tests.
Aww,
Oh, I only missed 6.
they did paper exams?
He printed it instead of submitting it, but.
I was afraid to put it, I knew it.
Dr. Clemente.
I emailed you your scores as well. I just emailed them.
You missed how many, Paul?
This is televised.
I think
right?
you missed six.
We're not
In
comparing.
my defense, some of these questions were misleading.
Well,
agree.
you missed some of them, but quite a few in common.
Which means they're bad questions.
Oh, that's,
Well,
that's what
Y'all
I'm saying.
And there were some,
Is this the exam that's proposed
there
to
were
get
some-
rid of?
yeah,
there were some
Too
typos in what we're getting rid
old
of.
people just.
I have taken.
Do we made a
So,
mistake,
I
you want
think
to
it's
look at it? I mean, you can open
Yeah,
it and
the
look
test.
at it without
Look at it.
taking it.
Yeah.
Okay, we have derailed here.
I'm generally for removing barriers.
So, Rule 6, the proposed application, the content of the application has been updated and to be modernized to include the NAVLE, to include language that the accreditation for the veterinary college is through the AVMA COE instead of just saying accredited, because it was just like accredited by what? That's how the rule is currently written. Adding a requirement about translating original documents. So this is just for DVMs, translating original documents that are not in English into English. Removing requirements that the board no longer asks for example, passport photos and handwritten statements indicating that the person is the person who's in the photo. For sitting for the NAVLE, I don't know, maybe that is still required, but we do not facilitate the NAVLE, and so there's no reason for us to have that in our rules. And the application requirements listed in the rule for the NAVLE are also being removed. The exam scores section has, section 3 has been amended to update the scoring and fee requirements regarding the NAVLE. We no longer collect the fee for the NAVLE. And establishing that the NAVLE is scored by the International,
Council for Veterinary Assessment.
yes, that's it. I don't have that in the summary.
It's looked at entire.
Yeah.
And then repealing the jurisprudence exam. So from my perspective, it is a lot of work for me to hand it out, pass it out to people and document it coming back in. Most people do pass the exam. Occasionally, we'll get a few people who fail and then they get it back, retake it. I mean, we have 3 versions of the exam that are emailed. They're all the exact same exam. The questions are just scrambled. And it is open book for the applicants, so they can just look up the exam answers. Now, I understand that practice of going and searching through the code is helpful. However, I think that there are other ways for that little scavenger hunt to take place, and we can do that through an affirmation, either in the application, which is similar to the application affirmation for the renewal application, which says, I have read these. We've provided a link in the application so that you can click on it and open it and read the Practice Act and read the rules right there. We can do something similar in the initial application. We can also put some of those questions or not questions, but some of that information that you think is so critical about the Practice Act that isn't really in question form, but maybe it is part of the affirmation. Like, I understand that I am required to obtain 40 hours of CE per renewal cycle, or I am required, or a veterinarian or registered veterinary technician cannot do surgery. Stuff like that, that's in the Practice Act that you think is important can go specifically in that section. One of the other things about just looking at it today, most of you have taken, all the veterinarians have taken the exam. No one had a perfect score. So we've had a veterinarian here today who received discipline for thinking, not knowing what's in the Practice Act. And we don't require that everybody take the jurisprudence exam every time you renew. So you forget information. And the 5 of you who are veterinarians here, and even Ashley, because RVTs take the exact same exam, jurisprudence exam, right? You forget things. And the Practice Act is going to change. I mean, we are literally doing rulemaking right now, and we are not going to make every registered or veterinary technician and DVM take a jurisprudence exam when we change the rules. We are not doing that, I can tell you that.
Well, I think the CE part of it, I mean, knowing what's going on, I mean, I was the impetus for the AVMA to change the USDA accreditation. I brought that up at the AVMA. It's the same thing here. And my argument was, well, graduated 30 years ago, and when's the last time you looked at, what the accreditation rules were? I think it's the same thing here. If you can put that as part of our upgrade or updating our license every 2 years, anything that, I think that has to be done in my book.
Well, I can tell you that a lot of veterinarians look at the rules and the Practice Act because they call me all the time, making sure that they are interpreting it correctly or asking questions on it. Sometimes the question is, I'm sorry, I can't provide legal advice, which you saw today. There are other avenues, so we can offer a CE. I don't know if I would be in favor of requiring that CE necessarily. It could be something that is put on our website, on BOA's website, that be offered, because we don't require it now. We don't require that CE and that refresher for veterinarians who have already been licensed. And the initial jurisprudence exam is not required by physicians, nurses, midwives, anesthesiologist assistants, podiatrists, pharmacy, which includes pharmacists and pharmacy technicians, occupational therapy, physical therapy, massage therapy, respiratory therapy, behavioral analysts, cosmetologists, accountants who are CPAs, and behavioral health and human services, which are like licensed mental health workers, so licensed clinical licensed social workers. And like Natalie said, it is an extra step in the process to get licensed that the governor's administration wants to get rid of these extra steps that aren't necessary. I don't know if the jurisprudence exam is really making people a better veterinarian or RVT. They should know these rules and have access to them and know where they are no matter what, whether they're brand new or they've been practicing for 40 years. I mean, and they're available on our website. They are available they will be available in the application once this goes through, and they are available now in the DVM renewals.
I like your idea about CE non-required, but still 1 hour every 2 years, where anytime things get changed, then we change that up. But then allow it, even if it's the same law, so we didn't change anything in 2 years, it's probably a different series. And you can still take that 2 years later for another.
And Dr. Shipman is working on like a dear colleague letter for initial applicants once they receive their license. And Dr. Shipman, you can speak to this more thoroughly than I can, but it goes over a lot of these requirements, even on the BOA side, like with rabies vaccinations and stuff like that. So they're getting that information once they get their license. I mean, not now, but they will be in the future. And we can have one for RVTs as well. And the information especially when we change things, it goes out in our bulletin. And we are keeping the website up to date as well with the current laws and the current rules. And even when we have something come up and we need to get information out to our DVMs and RVTs, we send out a separate email like, hey, we need you guys to know this now and not wait for the next quarterly meeting.
So to that point, as far as the dear colleague and what the impetus of that. So USDA is changing the accreditation process for initial accreditation. So it'll no longer be in person. They are flat not offering in person at all. It'll all be virtual. So we don't have the Board of Animal Health doesn't have the opportunity to deliver that content that we have traditionally done to those fourth-year students prior to graduation. So in lieu of that, we are working on a Dear Colleague, Welcome to Indiana letter for new grads, but it would be any initial licensee application that we would then outline kind of the highlights of the, the Practice Act and the BOA rules as far as rabies vaccination accreditation, but also whatever pieces, of value that we would then put there. The thought is to also, like Brittany mentioned, back in that CE piece so that they could take an hour of CE that is basically that letter in CE content, and so that they could obtain that, and it would make it a lot more nimble to update it as we progress through this rulemaking process. We can update that CE content that's available to practitioners, because yes, I agree. I think, having new grads know it is important, but having folks that have been practicing a longer period of time is also important that they know it. We still are maintaining the feedback mechanism for when they don't know it, which is coming before the board, right? And we want to make sure we're providing the opportunity for them to educate themselves so that they don't have to appear before the board. And I think through some of the rulemaking and clarifications that potentially could occur, we're going to get closer to that and them being more informed and more comfortable with the rules that are in place. And so it's kind of this multifactorial piece that we're trying to take into consideration, with this being the first step in that process, and potentially, an additional affirmation or two in that new or renewal process of maybe the very highest levels that the board wants to consider would be appropriate. I wouldn't want to do the entire 30-question exam as affirmation statements, but some very, very high levels could be in addition to CE opportunities. I wouldn't want to make that a requirement either, but lead the horse to water. If they drink, they drink, right?
And I also didn't include, this is included in the written summary, but I didn't say it. Maine, Utah, Vermont, and Virginia do not require a veterinary jurisprudence exam to be licensed, and California and Washington are in the process of removing the jurisprudence exam for licensure.
I'm just sitting here thinking the letter of affirmation that you have read this and understand it. As a brand new graduate, if I'm reading that, I'm still in scared stage. I'm going to look through that whole darn thing. And if it says I have to affirm that I've read and understand, I'm probably going to do that. Since graduation, if it wasn't for being on this board, how many times have we really gone back? I'm just speaking for myself, but to look at those, the things, unless it came in as an update through IVMA or a letter from the board or whatever, I wasn't doing that. So the thought about the CE, if that was offered, particularly if it was a free CE.
Oh, yeah, it would be.
Then I foresee a lot more veterinarians being exposed to our statutes if, oh gosh, I get an hour of free CE, and whatever they glean from that while they're doing it, so much the better, because they weren't doing that before. So I like that idea.
I totally agree with that. I think they have to be reminded of it.
And I think our response, all of our responses that we got from colleagues and whatnot, when we put that Dear Colleague out about technicians, there are a lot of people that are watching what we're saying and wanting to make sure they're on the up and up. I think this would be a huge success. Doing CE like that. Unless board suit. You just get down to the facts with these questions.
And that means
I
with
don't
grant
have to-
licensure, we don't have to say pending the successful completion of your jurisprudence exam.
Well, and when they currently take this exam, and it just says you passed, but they don't know what questions they missed or didn't miss.
I don't know which part they got wrong.
And I do, just as an
Best of
example,
luck.
being on this board made me get a question wrong. Because it says a registered vet tech can perform routine procedures defined by the board rules. We don't have board rules for what vet techs can do. That should be false, but the answer is true.
But that's what is in yes. Terrible test.
So
I didn't write it.
But you see what I'm saying? And there's another question about a vet tech can be a vet tech But also, you can give someone a special permit to act as a vet tech. Well, hell, we ain't given anybody a special permit in 15 years that I know
Because we
of.
don't have them.
No such thing as a special permit. I got that correct.
Take it up with Brittany. No.
I did.
No,
Brady, this
but
was a
you see what I'm
master class
saying?
in group persuasion. So, congratulations.
That's why I did it. And sent the link twice.
But,
Because you didn't do this.
but that's a
I would've
case
taken
where
it every
being on the
time.
board worked against me. I was looking for,
Well, and there's also, so there's questions on there about like how you can obtain your license by reciprocity, which is a weird question to be on there to begin with. Because if you're already, if you're at the point where you're taking the jurisprudence exam, then you already know how to get your license by reciprocity, and it doesn't apply to people who aren't getting their license by reciprocity. However, that rule, that question is tricky because in the Practice Act, which is what the test is based on, the answer would be, I think, true. But in reality, when they did when the General Assembly issued or redid just Title 25 for the occupations and professions in general, they changed reciprocity to almost immediate with no 5-year requirement to practice. That will be discussed at a later board meeting for certain. But like right now, that answer is true based off of what the Practice Act says, even though that is not how you obtain your license by reciprocity in Indiana any longer.
Clear as mud.
So,
We'll do we need to vote on this?
No, we don't vote on anything. This is just a discussion. So if there's anything in Rule 6 that you see that is incorrect or that you don't like, or any comments, speak now.
Okay,
How
This
does
is
the rule
free
repeals it.
rulemaking.
Okay.
if we make a rule change,
Yep.
if we recommend a rule change, what extra steps does it have to go through before it actually,
The rule.
yeah?
So we will, it has to go through the Office of Management Budget for
That's right.
approval.
There's a
And-
sheet in our folder, right? that
Yeah.
Tells us all the
Oh,
steps.
okay.
Cover back.
And then these rules, so even though we're discussing these rules now, they will probably not go any further until after November. Is that what we're gonna do, Gary?
Yeah.
Mhm.
Maybe,
Probably.
probably.
We're
So we
discussing
have
how many
one,
different rule packages to.
So we
Save
go,
the date.
they go forward, but then how long does it take for it to take quote unquote effect?
Say probably 9 months or more.
yeah.
What?
I mean, it takes a while. So this particular rule will not have to go to the budget committee because it doesn't have anything to do with any kind of
Okay.
fees or fines or anything like that. And then you have to have a public comment period and a public hearing, and then it goes to,
AG.
well, if there are a lot of comments, then maybe we'll have a second comment period, a second hearing. Those don't happen very often, but it could happen. Then it goes to the AG for approval, and if they approve it, then it goes to the governor for final approval, and then it's a rule.
I discussed the rules they discussed at the last meeting where that's not just.
I was gonna do that on my report.
Oh.
I don't want to confuse anybody.
She knows us.
I would never.
one thing that's interesting is that you're gonna have NAVLE decide passing score,
They already do.
whereas in the past, though, there used to be different scores for different states.
Mhm.
Remember, we had that guy from
Yeah.
Iowa that missed Indiana by 1 point?
So the NAVLE and the NAVLE and the VTNE are scored by the entities that put
The
them on. The testing entity, yeah. We are not currently dictating the score. Let them do it. We got enough to do.
Yeah, I forgot about that.
So do we need a motion to
They
accept?
accepted this past.
No, if there's anything that you don't want on here or that you want to add on here, then,
So you're gonna do away with the jurisprudence exam and replace it with CE.
Yeah, sort of.
See or attach
We're
We're
gonna
not-
offer CE.
To the.
We're not going to replace it with anything to be required for licensure. We will offer a CE
Okay.
for people
I get
to
it.
take
Right.
and be updated
So
on
it's
it.
still gonna be voluntary.
Yes.
It's gonna be,
But
it's going to become voluntary, not a requirement to take this jurisprudence. You're not forcing them to read the rules. It's up to them.
they have to sign the
Well,
letter of affirmation. They have to.
The affirmation says, I have read,
Read, right.
So that.
and they are provided. So, I mean, you can take the, I was talking about this at a different meeting with another veterinarian, and she didn't even remember ever taking the jurisprudence exam. Ever.
Oh, I
She
don't-
did, I confirmed, but how, like, you guys,
I don't remember.
do you remember
it.
taking it?
I remember where I took it, but I
I
don't remember what it
remember
said.
how I thought it was dumb that they told us to print out the thing and
Yes.
then we sat there and did it after we set the boards and like.
Well, I think
we're
as
so-
long as
That
every
was
2
nervous
years
and
when
then-
we
I didn't realize
upgrade
there was
or
a-
we renew,
You remember taking one, did
No.
Sat and-
if you put in there,
But I'm
you mentioned that you could
Remember that?
you could put a small paragraph, the changes have been made every 2 years before they.
So you're gonna
We
sign
can
an
retake it?
affidavit similar to the affidavit that says I did by 40 hours.
Do we have to have them sign?
There's
or
a
Or
we're
we'll
big
have
letter.
it done by the 15th.
Paul, the letter's right there.
Yeah.
That's the one. I mean, if you want to know what it says it right there.
It's in
Right.
in the affirmation.
Yeah,
You have the
you
affirmation.
have the letter
The
that
renewal.
that you're going to sign instead of taking
Go
the
back
test.
Mhm.
Oh,
In
it's
this
in there.
document.
Yeah, so the affirmation for the initial application is a little bit different.
Okay.
We haven't, so it's a little bit different because there
Is that-
there are statutory requirements in that. And we haven't added anything to it. We haven't, because we haven't changed anything yet. But it will be the same language that I have received and read and I have access to and stuff like that. Which this is, so for the renewal part of it, you guys never had to
Repeat
really
anything.
do it before. And they weren't, the rules and the practice act were not provided to you. They are actually provided now upon renewal, so you have access to them every time you renew. I mean, it sends you to our website, right, to the practice act that we have on there.
Go
If
for
we
it.
have the CE and we do it and then sign that, that's pretty much the same thing.
When
I
you
have
renew your
to-
license,
Good to see you all.
just another general question, because I'm gonna be doing that soon.
Yeah, we'll see.
When you're retired, all those questions that you ask, what's your primary practice, how
Take
far
care.
are you from your
Oh,
practice,
are we-
what
is our
animals do you
meeting date
practice
still
on,
the
what do you
same
do
for-
with those questions?
So if they, we're gonna talk about this, but if they click retired,
For
you don't answer any of those
conflict,
questions.
For
Skip
23rd.
some.
I haven't, didn't check it.
So you're gonna help me renew my license before I leave here today?
Yes. We will have a workshop on license
When is it?
renewal.
October 23rd is what it's set for. That's
And then November 13th as well.
Yeah, I have.
Oh,
true.
October 23rd, we're meeting? I want you all to know that's my birthday, so I will expect all kinds of.
Oftentimes we meet on Dr. Clemente's Halloween birthday, so
Oh.
now we'll have a new birthday.
Yeah, but now the
What's the
meeting will be the
November
week before.
23rd.
See you all in October.
That-
Or at the state fair in a couple weeks, you know.
Yeah, come by the vet thing at Pioneer Village. I'll
Third
serve
week of the month instead of the last week.
So Rule 8 with RVTs is,
some more.
it's similar, I've just changed all the rules for DVMs for the rules for RVTs. So the accreditation for veterinary technician programs is the AVMA CVTEA, and then veterinary, or the VTE scores come from the AAVSB.
Isn't that the, I always thought from like a legal perspective, when you actually put names to it, like that pigeonholes you into that. It's like, what if the AVMA, I don't know, crashed one day, and then you have that in your legal language? Don't you want it to be like accredited by a board approved by the board?
I mean, yeah,
That's
but
my
we can always change these.
Okay.
And I don't think that the AVMA is going anywhere.
Well, I'm just saying, like, any kind of language.
But right now,
like
it just
that's
says
how you want.
accredited.
Well, we're
And it
trying to
doesn't say-
clarify everything.
Accredited by what? So. Section 3 amends the scoring and fee requirements to make them specific to what the VTNE is doing now, and then also repeals the jurisprudence exam for RBTs. Which we've already
So
talked
your
about.
affirmation statement, that's what I was talking to you before this morning, for vet tech says October,
I know, but that's just,
but it's gonna be,
it'll be January 1st.
Okay.
Yes.
just so,
That's just a typo for you guys.
Yeah.
You're special.
See you for watching.
And you
Well,
are, good job.
You don't wanna do all that in October?
no, but it's,
We'd have more people come to us in our January meeting. 'cause
but this is basically the same.
For RBTs?
Yeah.
I mean, it's just specific to the testing and
Right.
the RBTs do.
The changes you made
education.
were,
What it says in here, Ashley, the American Association of Veterinary State Boards is its designee or current test administrator. So there's an open there to approve the test scores. So it's ambiguous enough that it's not nailed into just one thing.
I like that kind of language. That's just what I thought was preferable.
I know, is the vet language the same or not?
Yeah.
Okay.
Okay, moving on to Rule 7 and 9. Those, we can do at the same time. The recommendation is to just repeal those because the statute already outlines the requirements for reciprocity, and the statute trumps the rule. So. And we wouldn't ever put a duplicative statute in place into the Practice Act. So we would just use the title or the Indiana Code 25-121, which applies to the veterinary board as well.
so you said you're doing away with 7 and 9?
Yeah, I mean, they're redundant. Because it's already in the statute.
And the statute says that if somebody has a license in any other state and they're in good standing, they can get a license here. But that's not the case for other states. Do other states have to still take a test or do something else like?
Other states, a lot for vet tech wise, say, like you have to follow like their standards, like graduate from an AVMA accredited college, because there's some states, there's a loophole, like in Wisconsin, you can be from any other state and you can apply for the Wisconsin vet tech license and get it by the grandfathering clause, no matter where you live in the United States. So do you want to accept somebody that went through that route, or do you want to accept somebody who, passed certain criteria?
So the criteria, it is a little bit more specific than just having a license. Their requirements, if they hold a current license or certificate from another state or jurisdiction, and either A, the state or jurisdiction's requirements for the license or certificate are substantially equivalent to or exceed the requirements for the license or certificate of the board from which the applicant is seeking licensure or certification, or B, when the person was licensed or certified by another state, there were minimum education requirements in the other state. 2, if there were applicable work experience and clinical supervision requirements in effect, the person met those requirements in order to be licensed or certified in that state. And 3, if required by the other state, the person previously passed an examination required for the license or certification. And B just covers, in this case, older vets who didn't take the NAVLE, right? Because you took some other exam, or your school wasn't accredited because the accrediting body just didn't exist or didn't accredit that school at that time, and now they're accredited or something like that. It just, I mean, it gives a lot of leeway. There's no way I could check on every single applicant by reciprocity to see if the program met the specific requirements. However, every US jurisdiction and Canada, now they all take the NAVLE or the VT&E. I think now they all have to be through accredited DVM schools or RVT school or veterinary technology schools. So, I mean,
There's 3 states that don't require.
they don't require what?
They just do grandfathering. Alaska, California has an alternate route, like alternate route means.
Yeah, but there are some jurisdictions that just don't do, they don't actually regulate techs. So, that would be.
We don't need,
Yeah, we do.
just let them do the thing.
Yes, we do.
On the vets, there was I
I
read,
was gonna make a joke.
you know, the old, when you said the old vet, we used to have to take a clinical professions, I hope you dropped that out. Or they're
It's
gonna
not,
do that.
they don't even offer it anymore.
No, but I actually added it back in, included it because there are some cases, including Dr. Manning, who we took off of the agenda because it wasn't necessary to bring to the full board, but he had to apply by application for examination and get his exam scores sent to us through the AABSB, and he did not take the NAVLE because he's been a veterinarian for 30 or 40 years. So they're not required to take that test, but we will accept that test if they completed it before the year 2000 or something like that. So they don't have to take that exam,
Okay.
but we will accept it if that's the exam that they took, because it was the
At
exam
that
that was
point in time,
offered.
that's what was offered.
So that way we get more old works in here practice.
Absolutely.
Not for long.
Huh?
Not for long.
How long can they last? Talking about
That's
myself.
extra blood.
So any questions on Rule 7 or
Back in the
9?
1900s.
And then Rule 11,
Lots of us were in the 1900s. Thank you very much.
Rule 11, I really have just updated to make it kind of make more sense with the rule or the law change for expired veterinary licenses. When the rule changed a couple of years ago to allow expired licenses, more than 3 years expired, for the board's discretion on whether to require continuing education or remedial training, instead of making people take the NAVLE again after being expired for 5 years, I just thought that the inactive status should be, basically parity with the expired license. There's not really a difference between expired and inactive, other than the reason they went on the inactive status.
If we give somebody, if somebody has an inactive license, do they have to pay a fee every time they don't?
No.
I do in Arkansas.
I'm sorry.
I am too. I mean, I pay $25 a year actually to keep an inactive license down there.
Mhm,
And
I do
will
too.
no
In
way in
Arkansas.
purgatory will I go back to Arkansas.
I keep mine from Arkansas.
It's the same thing.
Mine's only 15 though.
I don't even know they know. They keep sending me a bill, so I pay it. So that's why I asked the question. I figure I have the dang thing. I used it active. And when I came up here, it went inactive.
Yeah,
You
so,
pay, but you don't have to have CE.
No
'cause you're
CE
in
or
active.
anything, no.
Oh, you Pat.
so if you're on inactive status in Indiana, you don't have to pay any renewal fees and you don't have to do any CE during that time. However, if you want to come off the inactive status with this rule change, it would be basically board's discretion.
So in other words, if you go through a lengthy illness or sickness or something and you know you're not gonna be practicing for 2 or 3 years, then we have to make a decision whether they need to get some CE updated or
Only if
anything.
they want to come off of inactive
Yeah,
status.
that's what I'm getting at, okay.
And the same thing if they're expired greater than 3 years.
Yes, in some instances, less than 3 years. I mean, if it was only a couple months, we probably I wouldn't bring it before the board, but if they've been expired for 2.5 years, I would at least ask Dr. Rodenbarger if, it depends on why they're expired, right? Like, have you been, I mean, maybe you just took time off to spend with your kids.
Maybe they didn't want to report
Well, that's
to you.
a bad reason.
Huh? That's a bad reason.
And when they re-up their license, they have to put that on.
Is the Peace Corps still active?
I don't know.
Because it says here,
Under my
veterinary
purview.
technicians in the Peace Corps. I don't know.
I haven't heard a commercial for it for a long time, that's for sure.
Well, that was,
That's a good search.
Can we take that out? Like, that sounds,
It's
it
being
sounds
Googled
dated.
as we speak.
No, it's by statute.
well, it is.
Appears to
Peace Corps
be
still exists.
a thing,
Still
an
there.
entity
Might not
today.
exist.
Well, that's one little piece that isn't gonna muddy the waters. We can-
Well, the armed forces thing is important, because I was practicing here in Indiana, and I forget the vet that came to practice I was working at.
Yes, the Peace Corps still exists.
And Broad Ripple, he said, we need to talk.
So
And I
they
said,
have to
okay.
read the requirements.
And he said, all right, you're all right. Yeah.
No,
For reciprocity.
Or
Because some
still a
states
thing
don't require CE.
for Google.
Yeah, but, I mean, I don't know if they require it for licensure.
What,
We
Well,
wouldn't,
licensure in Indiana isn't being required.
what, Purdue, you talking about faculty?
No, I was talking about reciprocity. Like, there are some states that don't have CE requirements. There aren't many left, but if they're gonna apply for us for reciprocal basis,
Yeah.
they don't have to demonstrate CE as long as they're in good standing with the state they came from.
I disagree with that. I'm sorry.
you don't require that now.
No, we don't.
But it's,
Well-
maybe it's because my brain doesn't work like it used to, but I think CE and updating and all this. And you said USDA was doing away with,
In-person accreditation, initial accreditation of 4th year veterinary students.
so are they gonna require it periodically?
Well, they're still gonna have to get
You're gonna
online.
continue they will have to go online to achieve that accreditation. So there will be no in-person, and there will be no state-specific material for Indiana delivered to those students.
Okay, so,
And they are not changing the CE requirement or accreditation requirements that also count for your veterinary CE.
Okay.
But the accreditation is also in place. So 3 hours for category 1 and 6 hours for
Yeah,
category 2 are still in
So
place.
you used to go, when USDA went to Purdue, you guys used to go and give them the Indiana deal.
Yeah, we would cover most of the talks for USDA.
Yeah.
So we'd send 3 to 4 veterinarians up there and work with USDA. They would give 1 or 2 and we would, I mean, it's a 8 to noon, presentation during that week between the end of rotations and graduation. Is when we would go up and deliver that content for that morning. And so, yeah, we would, whether it's disease eradication programs, TB brucellosis mitigation programs, pseudorabies, rabies, all of those kind of reportable diseases. What is a reportable disease with a foreign animal disease? The disease pieces we'd get into. Part of that at the USDA's request, we would cover them because we have more subject matter expertise in Indiana on those topics, but then also going into some of the Indiana specifics of we are one of the unique states that requires a veterinarian to be accredited to administer a rabies vaccine. And so we would highlight that piece as well.
And they got CE credit for that?
No,
No. Okay.
No, there's two.
because they don't,
You had to
yeah.
have it to graduate and do all those things.
Okay.
And
So now they have to do it all online.
correct.
Okay,
And so we don't have that touch point with them to get some of the more state-specific requirements. USDA does allow it, and if we wanted to, we could make any veterinarian who wants to be accredited in Indiana do an Indiana-specific accreditation, that they would still have to do all of the USDA pieces that they're now hopefully doing online, plus an additional accreditation through Indiana as well. I believe Michigan does that. It's a state-by-state process. We see that as an additional burden, and can we achieve that same desired end goal via another method, which that's why we're taking the approach of the Dear Colleague or Welcome to Indiana letter.
you brought up something, clarified something. You still have to be USDA accredited in Indiana to give rabies, right?
Correct.
What about, can technicians do rabies? We had a case like that, didn't we?
They don't match, the
There was-
statute and the Practice Act don't match, but they've said they will kind of, they will
It's
stick,
under
they'll
direct,
stick up for the veterinarian.
it's under direct supervision, they can.
They
There's
want,
a
But
registered.
isn't there a slight difference between the Practice Act and the, I was thinking it was the IVMA meeting when they came and spoke and they said, there is a discrepancy, but we will stand behind the veterinarian.
Yeah, like
Because
who
how
would
it's
sign the
worded.
certificate?
Hmm?
Like, that's what confuses me, like if the technician did it, like,
Does
you
that,
have to have.
does that would still be responsible for it?
But they were still under, I think it was RVTs under direct supervision.
yeah,
It's
but
not like you could go to
we've had a
PetSmart
case
in the
of direct
parking lot and
supervision,
start
the guy was
doing
out of the frigging office.
even though you're an RVT.
That's not
Oh,
direct,
I was
I'm
thinking
sorry,
direct.
telephone is not direct.
Correct.
That's right, they have to be
That's
on
why they
the
would be
premises.
in front of us if that happens.
We had that dental case,
I know.
I didn't agree with that,
That
you
would
know.
be different.
We can give all the other ones, but the old killed virus, leave that one be.
Oh,
And a lot of that comes into, and we get this question quite frequently, but looking at the chain of custody of that vaccine and the cold chain applied to that so that it is effective and that we can rely on it when we're making decisions of exposure to animals, that on the human side, we really have to rely on that being administered appropriately and having appropriately cold chain storage prior to administration, or else we don't have a lot of faith in the efficacy of that. We have unknown efficacy of that vaccine and then have to put through humans that may be exposed through additional treatment options. And it's not that like people don't get post-exposure treatment to rabies in Indiana, they absolutely do. Most commonly for bats, but
you still have a boatload of rabies in the bats in the state here.
yes. So I mean, that's our most common detection is in bats. We did have a resurgence in terrestrial rabies in southern Indiana, in skunk variant rabies in skunks. And so that was last year, we had 4 skunks detected. It had been 20 years since we had a terrestrial rabies diagnosis in the state. Likely came across the Ohio River. We have not had any detections this year. The period of time in which we would have historically seen that has passed. That's not to say we can't see it, but typically you see that you see those encounters with skunks and people generally around skunk breeding season, which is when they're coming, they're no longer dormant, like February, March, April. So when you see the most skunks. But I mean, there was a child that was exposed because they pet a skunk underneath a grill. There was some dogs exposed. There was some, that kind of thing, right? We also have had some potential exposures that we have the unknown status of an animal. So we don't know the status, and they were unwilling to euthanize that animal, monkey. And so,
Do we still have, what is it, so many weeks you can isolate the animal?
yes, there is isolation processes. So depending on when, depending on the vaccination status of the animal We have the little slide cards that navigate that pretty clearly.
Okay.
I'm not gonna pretend to nail down all of the finer points here. Because it is a matrix.
The slide cards are nice. Yeah,
There's
they are.
quite a flow chart there.
There really is. And we,
That's necessary.
yeah, and if you don't have that handy, we do have our website, the rabies.in.gov. It is a joint website with the Department of Health and us. There's also a decision tree on that website that you can reference as a practitioner to have a better understanding of that process. So that's the big piece around the why we take an extra step specifically on rabies.
Oh, look at Denise, is on top.
I'm a mind reader. How did I know?
Sounds like an eavesdropper.
The, do you remember there was a shelter in Logansport that used rabies vaccine for over a month expired and used it for about 2 months before it was discovered. All those people had to be contacted, revaccinate their animals.
You mean, oh, the animal?
I remember that case. A
But
shelter in Logansport.
Yeah.
For almost 2 months used expired rabies vaccine.
well, this was just a case we had today, you know, dealing with stray cats and stuff, you know, spay and neuter. What about the exposure to the humans? Because I'm one of those guys that I have zero immunity to rabies. I've been tested twice, taking the pre-exposure series. I just don't react to it. And they haven't killed me yet. But I don't know. And well, the other is off. The other thing is AVMA has, you know, there's been an outbreak of feline leukemia, there's been an outbreak of parvo and all that. We got vaccines for that stuff, you know. What we ought to be doing is stress and take care of your
What
dang on
rules do
animal,
we have
get a
left?
current vaccination status.
We're done with the rules? That was quicker than I thought. Pretty good.
My dog
Want to
had
move on to the reports?
My dog had to have surgery. I was just thinking about that. Made me think of the board. I was like, should I tell you that?
Did it have surgery or did it?
He had a
Is it
foreign
really a
body.
surgery?
He had a foreign body. It was a croc charm, like from croc shoes. Yeah.
Dude,
They're soft.
My little Frenchie. I thought something else. I was like, it's a Frenchie, something's horribly wrong. It was a croc charm.
So you have a report for us?
I do have a report for you. You can see from the report that you have that we had over this past quarter, we've had 1 complaint filed by the AG's office. And then we had 1 personal appearance today and 1 probation withdrawal. For the consumer complaints that I have filed on behalf of the board, we've had 1 standard of practice issue. No settlement conferences this quarter, but we have 1 scheduled for September. And I've done 4 VT&E retake interviews. Now, I will say that 2 of those that I have approved this quarter are 2 that you guys approved back in October, I think. So this is their it's gonna be their 5th try. And I have 1 Navli retake who I haven't done the interview yet. He has emailed and inquiring about it, so I expect that soon, but we haven't done that yet. Over the quarter, we had 68 applications for DBM, 92 licenses issued, 43 are pending. And at the time that I did this, 279 had renewed. That's over 300 now. And then RVTs, we've had 37 applications, 35 have been issued, 33 are pending, and 3 have been renewed. And then we did, for DVMs, we now have over 3,000 active DVMs. Now, I don't know how that will pan out after the renewals. I don't know how many are going to renew, but hopefully all of them. And we have a total of 2,290 RVTs. And then the probation suspended and revoked, all of those numbers are the same that we've had since I've been on because we haven't imposed any additional suspensions, revocations, or probation.
I know in Arkansas, I was the 187th registered vet tech, so 2,000's a lot.
Wow.
Well, I see this, I spent 11 years on the House of Delegates, AVMA. That number of veterinarians is key to the weight of our vote. And I don't know if that.
Oh, for the AVMA?
From the, yeah, I mean, in the House of Delegates, when we vote, it may be worth 14 votes because of the number of veterinarians.
Yeah.
And it really comes into if you got something, if you're running for an office, something, if you can take California, Texas, and New York, you're in. It's as simple as that. It takes, so that the number is important, and I don't know if our AVMA delegate, I don't know if that's reported up to the AVMA or not. I have to talk to Tony.
They must certainly inquire.
I have not been
wouldn't
asked.
count on it. You mean them who, the AVMA?
Yeah.
I don't know.
I mean, I don't know. I haven't been asked, but there is a way for anyone to purchase licensing information from the professional licensing agency, even for veterinarians. So
They don't
I mean,
have
they
to go
may.
through you to find out.
Yeah.
But I'm assuming they would do that if they wait to vote in the House of Delegates. They would want the current number of veterinarians for each state to make that adjustment.
So additional discussion items for RBT, the RBT audit, we had one additional RBT suspended April 28th for non-compliance. I don't know if we have a correct address for her because her suspension came back as non-returnable or non-deliverable. DVM renewals are open. Everyone needs to register or renew by October 15th. There is now a
And none of us have.
and none of you have. Dr. Shipman has.
Okay, I have a question.
But we all
Dr.
passed.
Moonsbury doesn't even have a license. So he's
Pretty
got to take
fast.
a
Pretty
jurisprudence
fast
exam.
is yours.
Yeah, you don't exist, but you did pass the test.
Well, on the survey, it gives, they want to know our status. Do I just put other because I'm not, doesn't say you're on the board or,
Are you retired?
I think so.
Then click that one.
Just put that?
Doesn't change the status of your license.
Correct.
Okay.
This is just data collection.
Okay.
There is a different question on the renewal if you want to place your license into inactive status. That's a different question than this. If you select retired, then you don't answer any of the other questions except the one about, it skips several, does it skip all of them? I think it might skip all of the rest of
You
them.
get a lot less questions if
Yeah.
you click retired.
That may be the way to go.
Well, if you don't, all the answers here will be.
No, I'm not wanting to, I just want to I know that the data.
I
is
asked the
important.
same question, John.
You did?
Yes.
All right.
Because there's about 15 questions as to what type of practice you're in. But I'm assuming if you check retired, it skips all of those.
Oh,
I'm assuming.
It does.
Brittany and I are going
Almost
to
like
renew my
Brittany knows what
license.
she's
As soon
doing.
as you guys leave, Brittany's going to help me renew my license.
The other
I'm
piece
sure I
to the
do it
renewal
right.
process and the demographic information that is being collected, you'll see that the questions have changed. They are more aligned with the data that AVMA collects as well. So you'll see a laundry list of like, what's your primary, what's the word we use? Primary, the long one. Discipline. So we're looking at discipline because there's a lot of different ways to split the profession up and try to categorize what you all do on a daily basis. And so AVMA uses primary discipline and like a secondary discipline. And it's a really long list of what that looks like. chose to use their list specifically in case they start publishing data using the choices on their list, and we could potentially merge that with what we know about the profession in Indiana. So we've tried to align it as much as possible.
Yeah, and on the survey, when you just grab your
Spanking?
clinical practice, if you select clinical practice, then you'll get another category that drops down to general medicine or surgery.
Okay, right.
Yeah, and it's tailored,
There's decision-making within it.
It's a
So
decision-making
The system
tree,
is offering you
yeah.
questions based off of how you answer.
The AI crap.
No, no AI involved.
all right here and there.
Fair trap.
I knew that I had a problem.
Me too.
One thing that is different on this renewal is that PLA is using a different web platform. They're now using ML1, when you go to apply, you want to click that link in the renewal. So on your renewal notice that you received from PLA, there's a link in there that you're gonna wanna use that link to log in with your Access Indiana, like you did previously. And then once you get into the platform, your license probably won't be there. So it'll say like initial application and pay invoice. And then underneath that, there's a box. And if your profile hasn't been linked from the old platform to the new platform, it will be empty. And underneath that, you will click, don't see your license. And you're gonna click on that. And then it's gonna ask you for different things to put in to try to identify you. You only use 2 criteria. So if you use 3 or 4 instead of 2, I don't think it'll work. You only use 2, and I would suggest using your date of birth and your social security number instead of your license number. And then it will link your profiles, and then, so in that box that was blank, it'll say veterinarian, and if you have a CSR, it'll say CSR. Next to that, there will be 3 little dots. You click on those dots. Don't do new application. Click on those 3 little dots. There will be a drop down that says renew your license, upload documents, a couple of different things. You'll just click renew your license and it'll bring you to the application. Then you will go through that whole process. You'll pay the fee for renewing your DVM license. And then you will go in and click those 3 little dots to renew your CSR if you have one. You cannot renew your CSR at the same time under the same payment. It has to be the DVM license first and then the CSR.
Okay,
Will there be
you
a-
are gonna help him after this one. Can you help me also?
In all honesty,
You paid extra for this.
When- and I did not look, I got the email saying, hey, you can start reading.
Right.
And I didn't look at it too close because it's not October yet. But is there gonna be any words of advice like you're giving us right now? Because in the email, is there, because this sounds a little
Did you get-
unnerving.
Did you get the bulletin the SOS
From
that
the
we
vet
sent out
board.
from the vet board last week?
Again, it's not October yet.
Yeah.
So,
But you
It
should
goes
still
there.
be
got it,
reading.
and I flagged it so I can find it.
We'll have that.
That's
That
what I wanted.
information
Is it on
is in
there?
there.
Because I did not read it very closely.
You can always call me too.
Yes,
But I'm honestly thinking about,
No,
Everyone else out there.
so we did
As
have
much
some
as-
questions at first, so we sent out
Okay.
an email from the vet board that said, hey, you have to link your profiles, you need to use this link in the notice. Now, we have updated the website to include that link for DVMs, for initial and renewal. I think RVTs are the only ones that are using the old platform for renewal. But for new applicants, they can use that platform. It's gonna be updated soon, but PLA's gotta go through.
And
The
one of them
platform
is
will.
on the receipts.
So, and people are not getting receipts once they submit. I've been told by PLA that those are emailed within like 48 hours of submitting. If you don't get your receipt within 48 hours, email me. I can send you one because I've had people who still aren't getting them after 48 hours.
PLA doesn't work that fast. What do you do?
I'm sorry, what's
PLA doesn't.
Since I didn't read it, I'm like, I'm assuming there was a little explanation because if she's a clinic, that's the average.
Because I had questions
Especially
when I was
older
one.
one.
Yeah, I was like, this doesn't make sense. So. And that, the system is looking for your veterinary license to go through before that CSR has been allowed to go, which is why there are two separate steps.
We don't need a CSR in here.
Not to be.
No,
I hope not. AM,
you don't need a CSR to be on the board.
I have to have an active license. I have to ask that question 9 years ago. Everybody yelled at me. Yes.
So we'll get you renewed today.
I think we ought to get about 6 hours of CE for every one of these meetings. Well, is it still that somebody can come and sit back here and get CE?
I don't know. I mean, that was a made-up thing that I don't think any of the other boards actually really do. And so
Okay.
to manage that is filed, but.
Then I agree with it.
Okay.
So that's
But the
what-
one person who did come in and got the CE, we will accept it.
Well, I'm the one that told him, because, you know. No, he was,
He has a certificate.
he's
Denise made
a
it for him.
retired Air Force veterinarian, you know, I knew him.
She's so handy.
Are you done?
No, I'm not.
Keep going.
Rulemaking. So the proposed rules 3 and 10 that we discussed at the last meeting are pending with the Office of Management budget. In early July, they had requested that the board add specific requirements for obtaining CE through an internship. The way that we had it written was just kind of a statement that you could receive CE for an internship, and they wanted something more specific, so we added information for that, and it was approved. And so we will hopefully get proposed rule 3 on the August budget committee. And we have no control over whether it'll be accepted for the August budget committee or not. If it is and it's approved, then hopefully we will have an open public comment period before the next meeting, and then we can do a public hearing at the next meeting and keep that process moving for that rule. The AAVSB, the annual meeting and conference, begins September 17th. Dr. Sunbury and I will be attending as delegates, and Dr. Shipman will also be attending with us. The 2025 nominating committee report and the resolutions packet are in the supplemental for you guys to review. If you have any comments or concerns, email me with that information. Email me and Dr. Sunbury with that information.
I'm going to.
Oh, you are?
Yeah, because you guys nominated me.
Better
Oh,
she's
okay.
running for office, you better be there.
Okay.
I
Do they
take it-
pay for that? Does the AAVSB pay for that?
I think so. I think when I had my nomination call, they said that, but I'll double.
Okay. And then
I'm sure you wrote her a letter and Jerry signed it.
maybe,
Signed it for me.
I may have done that too.
I'm
On
sure you
behalf
did.
of,
It was a well-written letter.
thank
by
you.
the way.
I think,
I read it. You didn't know you were so verbose, did you?
the legislative updates, the Practice Act has been amended to include those individuals licensed by the Indiana Horse Racing Commission to perform equine teeth floating under Indiana Code 4-31-6-12 from the requirement of holding a valid Indiana veterinary license to practice veterinary medicine in Indiana, and that was effective July 1st. The Practice Act was also amended to add the Indiana Horse Racing Commission to, the list of entities in which an animal's veterinary medical records and medical condition must be furnished within 5 business days without written client authorization. That also went into effect
I think I missed that.
July 1st. And under that statute, it's where like a law enforcement or like the CDC or some entity like that is saying, no, we need these records on this animal now, and you don't have to obtain written authorization. Because under the Practice Act, you do have to get written authorization to supply those medical records to somebody other than the owner. So these are circumstances where you don't have to obtain that.
That's always made me pause, because you get calls from other clinics all the time saying, I need records on Joe Sullivan's Misty. And if we were following the letter of the law, Joe Sullivan should come in and sign something giving us permission to release him to another vet clinic.
I thought that was professional to professional.
That might be an exception.
I don't think it is this way. It was kind of scary that because it's not an official body, another vet clinic, theoretically.
There's at least something in there about emergency situation, or that
But
there's
if
someone.
someone comes in with a dog for its annual wellness exam and switches clinics, and they go, well, can't you just call over to East 8 and get the records? And it's like, well, theoretically, that client's supposed to go into their
Unless
regular
that
veterinarian,
clinic was
give
really
them
wanting to get
written
rid of
permission.
that client to begin with.
Isn't that the way the law reads?
I think we need to be aware that the equine teeth floaters, they're gonna be out there in the real world doing anybody. I don't care what that was a big discussion.
Yeah, but I'm not pulling any more magazine articles out.
Yeah, and I think that the board discussed previously that unless there was harm to an animal, those cases probably wouldn't be issued.
Not much we can do about it now. The gate's been opened. So am I right about that? I don't think another vet clinic qualifies as an agency. Theoretically, if a client of yours moves to Fort Wayne and comes to me, and I call your clinic looking for records on that animal, theoretically, they were supposed to give you written permission to give me those records.
I thought they just have to get permission.
What about referral clinics? Same thing.
Because what if somebody moves to a different state, they can't come in?
I don't think anybody enforces that.
I know.
Nobody enforces it.
Yeah.
It happens all the time. But it's,
Oh, no. So here it is. It's just written in a different way than what you guys are thinking. So it says, except as provided in sections E and F, or upon written authorization of the client, an animal's veterinary medical record and medical condition is confidential and may not be furnished to or discussed with any person other than the client or other veterinarians involved in the care or treatment of the animal. So you could send it to another clinic without written authorization.
see, I interpreted that as to be if you send them to a specialist, not necessarily
Doesn't
to
say
another
that.
clinic.
It doesn't say specialist, it could be any other.
Yeah.
As long as they're treating the patient, then you guys can communicate.
And we wouldn't really know
Probably 100
to
years
ask
ago,
for
we
it if they
didn't
weren't
have
treating
people.
them.
I helped write the AHA
Was that when
referral
you were first on the
guidelines,
board?
so if you.
No.
I don't have to do that
It
anymore.
is amazing. Well, this is why, technology changes, rules have to change with it.
And then the last thing I have for you guys is the House Enrolled Act 1509 created a new chapter in Title V, which requires that the names of board members, along with their appointment and expiration dates, be posted on the board's website and on all agendas starting July 1st,
I wondered why that was on our agenda.
2025. Now you know.
So that's my expiration date.
I thought you were giving us
Expire
one.
on that date.
Yes. Oh, well, you already expired because I think your expiration was 2020.
I wonder what bumps
So
that
when-
on as
Are
a.
the expiration dates on
Yes.
They're on the agenda. You expired, I think.
There
in
are only
2014.
two non-expired.
there? Yeah, I expired.
Members.
Well, I hope the powers that be realize that institutional memory, if that's the
I
right
don't see
word,
those term dates.
is extremely important. that means Clemente and I can stay home. I mean, you know,
Recollection of history.
Different levels of experience is always important on a board.
So, as I said in my email previously, that this fall, we will start sending expired names to the governor's office to see if they want reappointments or not. You're all eligible for reappointment because there are no limits on how many terms that you can
It
serve.
used to be. But
Well,
I take
so
it all
it's
that's
for-
gone.
So,
I read that we can't all be Democrats, though.
Yeah, there used to be, it had to be half and half.
yeah.
yeah, it's
When I
still
was
like that.
appointed to the board, they actually checked to see where I voted in the last election. That was in
They asked me.
2010.
Honestly, I believe the board is still politically balanced.
Is what?
It
It's
is.
still
They asked
politically
me.
balanced.
Really?
We are.
We don't know the political affiliations, but it is still a part of the board, sitting of the board.
The
is,
statute.
the
Who
statute.
checks that?
The
governor's office.
Governor's
Governor.
office.
How often?
So you're saying
They
it
check
needs to
mine.
be, or you know that this board is politically
The
balanced?
governor's office, when they are considering their appointments, know the political affiliation of the board currently, and if there's an opening, they are taking that into consideration when they are refilling that position.
Jeez.
Yep, I had to fill mine in.
Well, I just remember
Or do they send you like an application or something?
Steve and John
No, I
and
just
Jerry came
remember
on the board.
Checking like Democrat or Republican.
You guys came on
Or
and
maybe
went
it's just a statute I read.
Yeah, all at the same time.
2016,
Yeah, 16.
all
Like a
at,
meeting.
all at once.
Yeah.
And Natalie.
And
No, it took us a while to get now.
the three
came
veterinarians,
on.
We came on and they came to the next meeting.
the three veterinarians that were on the board, were not told they were no longer on the board till the week of the meeting.
And if that
I'm
happens,
serious. Dick Headley, the chairman, emailed Cindy and said, how come I don't have the cases? Well, you're not on the board. Patty Kovach, Robin Waltz, and Dick Headley was like, see you bye. And I'm telling you, they had no clue.
And once we submit that information, we are not given a timeline.
Yeah.
I mean,
We don't always know what's communicated from the governor's office, or in this case, not.
Well, it took them forever to appoint us, didn't it?
Oh, no, you guys had to come on pretty quick because you were at the January meeting and we used to meet every other month. They were there in November, and in January, you guys started. They were at the November meeting, and like I said, Dick Headley was like, how come I didn't get the cases for this meeting? Well, you're not invited. He was chairman.
If we receive any information about your status on the board, we'll let you know.
Well, that's
as soon as we
The
know.
week before.
Well, I think if I was
Just
the
don't let me
governor,
go
I'd
through a
be
week
thinking,
of prepping.
if I'm the governor and I look there and say, wait a minute, this guy's been on this thing 15 years. I don't know. If you believe in term limits.
I mean, from being an attorney before other boards, I mean, there are people on the medical board that have been on for the same amount of time. So I don't know that matters.
I wouldn't try to predict.
Yeah.
We have no
I would
information
hope,
about
well,
the philosophy right now.
Like I said a while ago, institutional memory, and that doesn't mean that, I mean, I'd hate to lose Paul because he's got a better memory than me. He can remember, and serious, I'm serious about this.
Well, I just remember Patty Kovach and Robin Walsh used to split the liaison duties, reviewing cases. And next thing I know,
You're reviewing
Bill Somerville
cases.
goes, you're doing it, okay? And that was that. All right, does Kyle, you got more to tell us? Is he up to, you have a report?
Yeah, he's up.
Yeah, I'm just waiting on everybody to
I'm done.
I'll quit chatting.
silence. themselves.
I need to have Brittany renew my license before I leave.
Doctor,
Yes. Thanks, everyone. So a few updates specifically on highly pathogenic avian influenza. Hopefully you've not seen it in the news as of late. This would be an anticipated lull in cases as migratory birds have decreased currently. It's not the active season for that. Last week across the country, we were happy to see that no cases were confirmed in birds or in livestock. That's the first time we've had a 0 week in 2 years, I believe. So we're at least hoping for a slowing, especially on the livestock side. So as you see in my report, the May 27th, we were able to declare Indiana free from highly pathogenic avian influenza. That's on the bird side. That's through WOA, the World Organization of Animal Health. That's a big deal. That allows the trade to reopen. Generally, countries impose trade restrictions, and it can vary either at the country level, the state level, or the county level. So us declaring that freedom status at the state level is important for any of those the trade restrictions that are applied at the state level. Generally, that opens back up Canada for us. So sometimes Mexico as well. So, and we have a lot of product that moves to both of those countries. So we're excited that we were able to regain that status. We are actively working with those companies that were directly impacted to do a lessons learned. Also doing a hot wash internally to better understand how we can handle things any differently. The incident definitely developed over the several months that we were in the midst of all of that. To USDA's credit, they entertained new policy. So BOA actually proposed and administered 5 different policy changes. So where we wrote new policy for USDA's consideration, and USDA allowed us to carry out that policy. Generally, that's around handling of manure, handling of eggs, and a few others. And so that's really difficult to do in the middle of an incident. But our poultry companies and our industries continue to challenge us and provide us with creative ideas. And so we want to work with them and package that in a way that we can make sure that it supports science and also supports the continuity of business and continues to safeguard the rest of Indiana. So we're incredibly happy with that process and continue to prepare for what lies ahead. We don't know what the next migratory season will look like. We anticipate there's a likelihood of more cases. Just know they haven't gone away, right? So, most recently, Pennsylvania had a case of around 30,000 birds. Just prior to that, a few weeks ago, Arizona had a case, or several cases. I believe there are upwards of 4 million birds that were impacted there. So, and that was incredibly hot weather. Generally, we don't think influenza doesn't like hot weather, but it can still impact domestic birds. So they had, I think, 8 consecutive days of over 100 degrees, and these birds still got sick with influenza. So it is a challenge, and we don't anticipate it going away. There's a lot of conversation right now around vaccination of these birds. It's still a hot topic. Trade implications are one of the biggest barriers to that, and to the implementation of vaccine in the U.S. So they're working, USDA is working, and supposedly sometime in the month of July, I believe, is supposed to put out a comprehensive national plan of what vaccine could look like in the U.S. That then allows the trade negotiators at USDA to start negotiating with other countries to see if they are willing to accept that vaccination strategy. So that's where that is. Moving to dairy. So we, on June 13th, the state of Indiana was able to achieve stage 4 unaffected status in our dairy for highly pathogenic avian influenza. So that took 3 rounds. There were 3 monthly rounds of negative surveillance of all grade A dairies in the state. So we were using milk quality samples to ensure, and running those up through Purdue, the diagnostic lab there, to ensure that those animals are negative and our food supply is safe. So we are continuing in our stage 4 monitoring. So we're in maintenance phase now. Again, we want to make sure that our dairy cattle aren't sick, and therefore are also getting our poultry sick as well, because there is a relationship there, or can be a relationship there. Last but not least, Something that we are working through the Center for Animal Policy was with the Farm Journal Foundation, again, looking at the veterinary workforce initiative. So Brittany has attended several of those meetings with the State Department of Agriculture, the IVMA, the College of Veterinary Medicine, and BOA to try to wrap our brains around what the potential confounding factors are in the shortage areas across the state and what might be contributing to that. And so we are currently working towards a Find a Veterinary Practice tool, which would be a voluntary dashboard in which veterinary practices can elect to provide their information in, so that consumers can access on a one-stop shop website through the Center for Animal Policy of what services are offered at particular veterinary clinics if they're looking to seek care. What we commonly see now is a mismatch of care. So we have veterinarians that are able to see more clients, both small and large animal, and we have people that are unable to seek veterinary care and they're not generally in the same location or they're not willing to pay for the services, right? So we're trying to understand what that disparity of care looks like. And we're hoping that by the first step of providing a tool for citizens to at least understand where veterinary care is available in the state by species, by geographic location, is a step in that direction. I don't know that it's ever going to fix the disparity of care, right, if we're unwilling to pay for those services. So that is a piece that we are working on. Also, some of the questions in the demographics of your license renewal also aim to help inform that working group from the Farm Journal as well, to better understand what the debt burden is of kind of the Indiana veterinary profession. We're not looking, all data is in aggregate and is reported in aggregate and confidential. There's ranges of debt, so we're not looking for specifically exactly how much are you in debt, but as an overarching idea, what is that general burden? And we can look at that based off of graduation year as well, right? So are we seeing a trend of increasing debt burden, decreasing, and then that brings in the conversation of an additional, the potential for a loan repayment program of some sorts, potentially at the state level, which has been in conversations for several years now of what that would look like to help incentivize veterinarians going into rural communities. Some of the proposed language there also includes registered veterinary technicians, and they would be eligible to have their loans, have a repayment process for their loans there. So we are actively working to collect that data. We are working with the commodity groups. We're also working and putting basically a survey tool. So if someone says, hey, I can't find a veterinarian, like we want to know about that. So they can submit that to us so we can start documenting where we're hearing concerns of being able to seek veterinary care across the state, and if there's any trends in that. I believe that is the highlights of my report.
Thank you.
Thanks.
Next meeting is October 23rd, and then November 13th is our special session. Yep.
Any other input, comment for the good of the order? What's that?
Hulk Hogan died today.
No, brother.
Yeah, first it's Ozzy Osbourne, now it's.
Ozzy Osbourne?